Hey, this is Dr. Jack Wolfson, board-certified cardiologist and author of the Amazon bestseller, The Paleo Cardiologist, The Natural Way to Heart Health. Today, I want to talk to you and give you the truth about statin drugs. Millions of people take this pharmaceutical class. Certainly, it lowers numbers down, but the question is, are these drugs effective, and is there a better option for you? All these different pharmaceuticals are statin drugs. They are known to lower cholesterol numbers down. That is without debate. But again, the question is, are these really benefiting you, and is there a better way? And that's what we're going to be discussing today. The evidence behind how these drugs work and their effectiveness or lack thereof. Statin drugs work by inhibiting an enzyme up here, where you see me circling that up on the screen. And what happens is we make a molecule called acetyl-CoA, and that we make from fats, carbs, and sugars. And then from there, it goes to HMG-CoA, and then statins are also known as HMG-CoA reductase inhibitors. So we stop the process from moving along down to this area, so cholesterol is never made. Now, also important are the fact that ubiquinone or CoQ10 is decreased in production. Dolichol can be affected, and dolichol is found in the substantia nigra of the brain. So very important, I believe, for the prevention of Parkinson's disorders and similar conditions to it. Also affects prenylated proteins and the formation of all these other nutrients. We're messing with the body by giving statin drugs because it's going to impact how things are produced later on, and that is problematic and it leads to side effects in so many people. So let's take a look at some of the primary prevention trials regarding statin drugs, and today we're only talking about primary prevention. This information does not apply to someone who has had a heart attack, someone who has had a stent or bypass surgery. This is primary prevention trials. So let's take a look at this one here called HOPE-3. This is a recent trial with a very popular statin drug, rosuvastatin, also known by the brand name of Crestor. And they looked at that drug versus placebo, and they followed these people for over 5 years. And once again, these are people at intermediate risk with no history of heart disease. So these may be people that smoke, maybe people that are overweight, maybe people with diabetes, maybe people with high blood pressure and with abnormal lipids or inflammation, intermediate risk people. And you can see their risk characteristics here as reported in the New England Journal of Medicine. They take the group of over 13,000 and they put half into the rosuvastatin group and half into the placebo group. And then they look at things like age. So look at these numbers and see how well this really applies to you and the age category you're in. So you got age 65 on average. There was, let's call that 50-50 females to males in there. The people had elevated waist to hip ratio, so these people were overweight. Over a quarter were smokers. So we're really identifying a kind of a high risk, they'll call it intermediate risk, but we got people clearly with risk factors. Low HDL, abnormal blood sugar, early diabetes, family history of premature coronary disease, high blood pressure is present in well over a third of these people. And once again, almost half the people had at least 2 risk factors, and a quarter of which had 3 or more risk factors. And you can see here as well that their blood pressure at the time they enrolled in the study was also on the higher side. And here, once again, we see this body mass index is high. As far as their cholesterol levels are concerned, you can see here, total LDL 127, HDLs, triglycerides are a little high. We like to see that below 100. Blood sugar was 95. That is high. We like to see that below 85. And then we have evidence of inflammation, high sensitivity, CRP. The average was 2. The median was 2, which is essentially the same for our discussion today. So elevated inflammation in these people. So these people are definitely at risk. Do they benefit from statin drugs? Well, Remember, they're followed for over 5 years. And look at the death rates from cardiovascular causes. The statin group did better, 2.4% versus 2.7%. Not really a big difference for all these people taking the statin drugs. Now, heart attacks were a little bit lower, strokes were a little bit lower. You can review the data. You can stop this presentation at any time. But if we look at heart attacks, let's say 45 people in the statin group had a heart attack, 69 in the placebo group. Number needed to treat 250. That means 250 people take the drug for 5.5 years to prevent one person from having a heart attack. These are not my interpretation of the numbers. These are not my opinion. These are the facts as presented. Now, what I'm all about in my practice is not about lowering your risk from 1.1 down to 0.7. I want my patients to be at zero risk. But we can see here what the statin drugs are doing. Stroke risk was also reduced. Number needed to treat, 200. Again, 200 people need to take drug for 5.5 years every single day in order to prevent one person from having a stroke. Moving down, death from any cause. Now, this is, I think, the most important thing, because it's not a matter necessarily how you die. It's, are you living or are you dead? And you can see that essentially there's not any difference at all between these two groups. Number needed to treat, 333. That means, again, 333 people need to take drug for 5.5 years to prevent one death. Now, you may say, hey, I may be that one person. You may be the one person that suffers side effects as well. That being said, I don't want my patients at 5.6 or 5.3. I want better. I know they don't offer any better, because what they offer is what you see there. The best they can do is 5.3%. I think that we can do better. Another trial called the All-Hatch trial. I know these have interesting and creative names, but bear with me here. This study looked at over 10,000 patients. They were above the age of 55, hypertension, other risk factors. They got a different statin drug called pravastatin. Primary endpoint was all-cause mortality. Well, you can see here on all-cause mortality, overlapping graphs. This drug did not prevent all-cause mortality. Period. End of story. Now, if you throw in non-fatal heart attacks, there was a tiny benefit in the statin group. But their primary thing they looked at was all-cause mortality. It's right here, black and white, with the source on the slide. This study showed that there was no benefit to statin versus placebo in this group of primary prevention people. And one of the authors of that study made comments. We've been going along thinking that the statins are the answer to all of our atherosclerotic disease problems, and they're not. Dr. Ferguson. Ascot LLA. This is another trial. 10,000 patients, ages 40 to 79. These people had 3 cardiovascular risk factors, and they were assigned to either atorvastatin, which is Lipitor, 10 milligrams, or they were put on placebo. And here you can see on this busy slide, and I know a lot of you are not statisticians, but let's go right down here. All-cause mortality. Who lived and who died at the end of 3 years. You can see that there is essentially no difference here, or a small difference in who lives and who dies. Now, if you want to go back up here and look at that endpoint again about fatal and non-fatal strokes, so people having strokes, and you look at this 3-year point, they give us this big difference here. And this is what they show to the doctors in the offices and make it look like it's a big difference between the two. Look how far these lines are apart. Wow, that must be a huge difference. But if you look over here on what's called the y-axis, you can see that this is just the difference of less than a percentage point. Less than a percentage point. So here, number needed to treat is close to 200. Number needed to treat here is 100 when it comes to total coronary events. So now, once again, 100 people take drug for 3 years to get that difference of 1%. But once again, when it comes to living and dying, all-cause mortality, no difference. The Jupiter trial, another trial involving the use of the statin drug rosuvastatin. These were people that had inflammation Otherwise, they were apparently healthy people. And you can see here that death from any cause, they have a small graph here where it looks like there's a bigger difference, but when they display it out as they should, you can see at 4 years, they're basically overlapping lines. There is very little benefit to the statin drug in this group of people for primary prevention. There is a better way, and I talk about it in my book, The Paleo Cardiologist. Here's more information, once again, about other endpoints in that study: heart attack, stroke, death from cardiovascular causes. Here it looks like it's very big difference, couple of percentage points, so it's not nothing, it is something. But according to their literature, which they produce on their dime, that's a whole different story. But in any case, if you look at the y-axis, you can see this is not from 0 to 100. This is 0 to 0.8. If you put it on the 0 to, 1 scale, or the 0 to 100 scale, you can see after 4 years, very little difference. These are just the facts, and I'm just here to show you that if you think that you are being saved from heart disease because you're taking a statin drug, you're wrong. The benefit is trivial at best. Here is another study: all-cause mortality and cardiovascular death. This is basically, looking at all-cause mortality here. In this study, the statin drug group did a little bit better than the placebo group after several years of therapy, but they're close. The only thing cardiologists prevent is you achieving extraordinary health. That is just the fact. For prevention, aspirin, statin drugs, blood pressure drugs, they have very little, if any, benefit. We need to do better, and that is what I am all about. So let me give you my top 10 ways to get better. Actually, top 11, I apologize. I added one more on there, so I'll give you the bonus one. Number 1, eat paleo. Eat the foods our ancestors consumed. Bring it up to the 21st century. Eat tons of vegetables. Eat organic. Eat nuts and seeds and eggs and avocados and coconuts and free-range grass-fed meats and wild seafood. Get rid of the sugar. Limit the dairy. Get rid of the gluten and the other grains, and watch your health miraculously recover. I see it on a daily basis. Get sunshine. The sun is the source of all life. The more sunshine you get, the lower your risk of cardiovascular disease. Sunburn bad, sunshine good. Get naked in the sun. Get sleep. Stands to reason that we need to sleep. Sleep is when we recover. We go to bed with the sun down, awake with the sunrise. It's just how our ancestors have done it for millions of years. Get active. Get outside. Walk, bike, hike, garden. Do whatever it is. Do it outdoors. And if you can get naked doing it, please do so. Get relaxed. We got to get the stress out of our lives, however you need to do it. Add in some yoga, some meditation, some Tai Chi, or just, once again, just kind of get into a quiet room and just chill out for a little bit. Unplug. Get grounded. Walk, stand barefoot, outdoors. Walking on the beach. Everybody knows they feel best when walking on the beach in the sun. Get away from toxins, all these environmental pollutants, all of these indoor air products that we use, such as laundry detergents, fabric softeners, dryer sheets, perfumes, colognes, Glade plugins. Get rid of all the poisons in your house. Limit your exposure to EMF. Unplug the Wi-Fi, or turn off the Wi-Fi at night. Get the cell phone away from your head. Minimize carrying it on your body, and please don't carry it on top of your heart, by your chest. Get adjusted. Get adjusted by your doctor of chiropractic. If you have a DO who does osteopathic manipulation, get that work done, and you will do so well. Get hydrated. Drink high quality water. We sell a fantastic product on our website from a company called Pristine Hydro. Go to our shop page for that. I love drinking Pellegrino water out of glass. Get tested. Get the best testing in the world. Really learn what your risk is. All these studies are done with statin drugs using 1970s testing technology. There's so much better, so much more we can do. Now, find yourself a good holistic doctor or come out and see me. And then finally, get supplements. Evidence-based supplements work. And here we've got our trio. This is how I start off every morning. We got the Superfood Daily Green Beetroot Powder. Superfood is Chlorella spirulina. And the benefits of those nutrients are just absolutely tremendous, including improving your lipid profile naturally without pharmaceuticals and using spirulina and chlorella, which have evidence of efficacy to improve lipid levels. Daily greens, are you getting your multiple servings of green leafy vegetables every day? If you're not, you may want to take a greens powder. And the beetroot powder, of course, just really ramps up your levels of nitric oxide. Nitric oxide opens up blood vessels. And if you are someone who's got high blood pressure, coronary artery disease, inflammation, oxidative stress, you name it, get that beetroot powder. So for today, in conclusion, I want to thank you so much for being on my presentation. And I certainly welcome any of your questions regarding the truth about statin drugs.